Good afternoon. My name is Fred Kowal, President of United University Professions, and I want to thank all of you for joining us today for the second in a series of 3 panels that we are holding that feature the experts who work at SUNY Downstate, who work on the patient care, the education, and the research that makes this outstanding institution so crucial, both to the Central Brooklyn community, but indeed also for all of New York State. You know, when I first became aware that there was a plan to close Downstate, several questions immediately came to mind. First and foremost, how could this even be considered as an option? When you think about the life-saving work that goes on at Downstate in Central Brooklyn, in an area that is highlighted as one of the worst places for racial disparities in healthcare, how could anyone in our political system, let alone the leadership of our state, even consider such an option? Second, you just go back 4 years to the depths of the COVID pandemic. Governor Cuomo at that point chose SUNY Downstate to be a COVID-only facility. And as such, the work done there kept all of us safe and indeed saved the lives of countless people. And yet, when Downstate was chosen to be a COVID-only facility, the state provided no resources to compensate for the revenue lost or the costs of the conversion to COVID-only, and then afterwards converting back to full patient care. So how could this be considered? How about the research and the education of the next generation of healthcare professionals, especially considering the fact that Downstate graduates the most diverse class, racially speaking, of healthcare professionals each and every year? Certainly in New York State, the latest data that I saw was east of the Mississippi. Again, the closure of the hospital would dramatically impact the education and training at the medical school. And again, the question immediately comes to mind: why would this kind of policy be pursued by SUNY and indeed by the governor as well? That's why we think it's crucial. There has been so much work done, so much work by the people who lead the UUP chapter at Downstate, along with our union siblings in PEF. We've been working so hard to make sure that legislators and the public are energized to stop this plan, and much has been accomplished. These panels are another avenue by which information is provided to the community, both the community within Downstate as an institution, but then also to the broader community, and yes, to the legislators who are making decisions over the next couple of weeks, along with the governor, as to what happens with Downstate. The timing is crucial. That's why we have brought together this panel today. But as important as this is, we need leaders who will speak out within the setting of our political system. And we are joined today by someone who not only has been incredibly passionate and articulate about the importance of Downstate, he has also worked with community groups, with unions, to come up with legislation last year and again this year, put forward within the New York State Senate, that is a way forward that will enhance Downstate and enhance healthcare within Central Brooklyn. This individual is someone who I'm very proud to work with, someone who is a true leader on issues of social and racial justice, and obviously also in terms of healthcare access. And so I would like to turn the microphone over to Senator Zellner Myrie, who joins us to make introductory remarks as we get going. And so, Senator, once again, it's great to see you.
Great to see you, Fred. And let me start off by thanking you and all of the members for the incredible advocacy, organizing, work, resource gathering that you have been involved with since we got wind of this plan. I have been involved in a number of fights in my time up here in the legislature, and there has not been a fight like this one where we were required to so quickly organize and UUP stepped up to the plate very quickly, answered the call. And what is good about this fight is that it is not new to us. It is unfortunate that we have been fighting for downstate almost every single year that I have been in the Senate over the past 6 years. And this is a fight that is incredibly personal to me. As I have shared publicly, when I had COVID-19 pretty bad, I was in the ICU at downstate. I get my primary care, as does my wife, from downstate. And I grew up in the neighborhood, going to downstate and going to Kings County. This is where I have received my health care. So when we got wind of this plan, I made it very clear from the beginning that you will not disrespect my community. You will not disrespect Central Brooklyn. You will not bring closure when you have not brought resources. We will not accept this. And I want to make sure that there is clarity, that there is no confusion. What they have proposed is a closure. What they have proposed is disrespectful, and what they have proposed is not a transformation. This is the eradication of healthcare services in Central Brooklyn. So I have been proud to stand with UUP, to stand with the members who have given their lives, literally, to saving people in this community, and I will continue to do so. I will also say that we are in a pretty tenuous time as we have to make certain decisions by April 1st. That is when the budget is due. But this year, we have the added complication of Easter falling a little earlier than April 1st. And so there is conversation around decisions being made before March 28th, which is right around the corner. And what I have tried to do is to communicate to everybody, the governor, the chancellor, and even to some of my colleagues who have supported this plan. And let me also point out, I see my sister, Assembly Member Jamie Williams, who has been a staunch supporter of the community and has not been with some of the confusion and foolery that I have seen elsewhere. But I think it's important for the community to be clear on what is needed at this time. Yes, the resources to keep the hospital open, to keep things operational, to deal with any of the capital needs. But we also need a plan of sustainability. We need a plan for a path forward that is successful, a world-class institution delivering world-class services, because our community deserves no less. So I have introduced some legislation, as Fred alluded to, in partnership with community stakeholders and our friends in labor that would create a real process for us, help us get by for the next couple of months, and then put us on a true path of sustainability. I am hopeful. We put this in our Senate One House proposal. That is our view on what the budget should be, that over the coming days, we will come to an agreement with the Assembly and with the governor to include that legislation in the budget. But if not, and I will end on this, Fred, I am prepared to do whatever is necessary, up to and including voting down this budget, up to and including marching from Brooklyn to Albany, up to and including marching in front of the governor's office or the chancellor's office, because we will not accept a closure of this facility. We will not do it. I promise you that. So again, thank you so much for all of the work that y'all have done. Please feel free to reach out to my office with any questions that you need, but you have incredible leadership. I have shouted out Fred. I got to give Raditha a shout out for all of her amazing advocacy. She was just doing her thing last night at the community board meeting, but has been the same person in public that she has been in private, as has Fred. So please trust that you have really good advocates, and we will not rest until we have a true plan for this institution. So thank you again, and hopefully I'll get to see a lot of you soon in person.
Thanks very much, Zellner. Really appreciate all the work that you're doing and the shout outs. And yes, really important for us to recognize Raditha Abraham-Nichols, who is the chapter president and just a nonstop fighter for downstate. Senator, if you need someone to walk with up from Brooklyn to Albany, I'll be there wherever you need us to be. And for me to be there, I will be there. I am lockstep with you that this is a fight that we will not lose, whatever it takes. Absolutely. So thank you again for taking the time out of your busy day to join us today. to support the senator's work and the work that many others in our state legislature. The senator gave a shout out to Assembly Member Jamie Williams, and also there are staff members on, one that I see already from Senator Chu's office. Thank you for being on. It's really crucial that we all do our part to save Downstate. There's a link that Christy Salmons, our director of organizing and outreach, has posted in the chat. Click on that link and you can sign up to come to Albany next Wednesday to lobby. As the senator said, it's going to be close to the finish line. We need to be heard. We're going to rent a bus for y'all. We'll bring you up. Anyone who wants to come in to do that important delivery of the personal message to legislators to fight for us and to stay strong if they are already with us. We really are in the last weeks of the budget fight, and we need you. I'll make it personal. I need you. This fight is intensely personal for me for many, many reasons, but most importantly, because I believe that it is a fight about racial equity. It is about social justice. It is what unions are always at the forefront of in terms of the fight for a better world. We can win this, but Brooklyn needs to be heard. And as I said, today, we are raising our voices in a different way. We're bringing in experts. It's really the same message, only it is presented in a way that hopefully will show that what we're dealing with here is a policy that has not been thought through in terms of its ramifications. And so it gives me a great deal of pleasure, and I'm honored to introduce colleagues from Downstate who are on the panel. I'm going to introduce them one at a time, and they'll take a couple of minutes to introduce themselves, and then we will get to the questions and the dialogue. If you have any questions or anything you want to post in the chat, please do so. We're having a dialogue here, okay? We want everyone to be informed and, yes, energized to act. I will start with Dr. Camille Clare. Please unmute yourself. Go ahead and introduce yourself.
Thank you, Fred. I'm so on fire by Senator Myrie's comments. My name is Camille Clare. I'm an obstetrician and gynecologist actively practicing here in Central Brooklyn. I'm also a tenured professor and chair of the Obstetrics and Gynecology department at Downstate, and where we educate medical students, we educate the future obstetricians and gynecologists in our community. I also have a fellowship program, one of the oldest in the country, to educate individuals to take care of people from a gynecologic oncology perspective. So I'm so excited. I think I needed Senator Myrie's comments to get me going today. I'm a product of the union. My mother was in a union 1199, and I literally struck with her when I was a child. So I'm so on fire for this conversation today. I'm so excited to talk about what these efforts would mean for my patients that I take care of every single day here at Downstate. So thanks, Fred. And thanks, colleagues, for being here.
Thank you, Camille. Next, we have Dr. Michael Augenbraun. Please unmute and introduce yourself.
Thank you, Fred. My name is Dr. Michael Augenbraun. I am the Division Director in Infectious Diseases at Downstate and at Kings County Hospital. I've been at Downstate for 36 years, born and raised in Brooklyn, so this is home for me. And whatever is said and whatever is done cuts close to the bone for me. Let it not be ignored. I'm also the hospital epidemiologist at Downstate, and been a witness to many changes over the many years. And I'm happy to participate in whatever way possible to support this institution. It provides critically important work, both in education and clinical care, and its absence would be sorely felt and diminish quality of life in this borough, if not the entire city or state. So thank you for inviting me.
Thank you very much, Michael. Next, we have Dr. Lisa Dresner. Please unmute and go ahead.
Hi, my name is Lisa Dresner. I'm a practicing general surgeon at Downstate. I am responsible for all of graduate medical education. I'm a former program director of surgery and now responsible graduate medical education. Graduate medical education is administratively over all of the residents and fellows. Residents and fellows provide patient care at Kings County and Downstate and the VA and other medical centers across Central Brooklyn and New York. I'm happy to participate and work very hard because losing University Hospital would severely impact graduate medical education and the care of patients in Central Brooklyn.
Thank you very much, Lisa. And last but certainly not least, we are also joined by Dr. Randall Barber. Please unmute and go ahead, Randall.
Yes, hello to all. Okay, I'm Randall Barber. I'm professor of pathology at Downstate, and I teach in the first year medical students on the Foundations of Medicine curriculum, where I discuss elements of functional anatomy and topics on molecular and cell biology and biochemistry. I have had a particular focus in research over the years. Early in my career at Downstate, I had the opportunity to introduce a new form of medical imaging that has gone on to foster the development of a new scientific field and a new industry. And I should say, I want to emphasize that this capability would not have been possible if it wasn't for the diverse set of resources and faculty who were present at Downstate. It just would have been impossible. I should say that the technology that we've introduced is widely used now, and it supports investigations of the brain function in the everyday environment. This includes almost any type of social setting, such as interactive group learning, mother-child interactions, classroom settings, as well as engaging in complex behaviors in special environments, such as surgical suites, playing of musical instruments in a live orchestra, piloting of high-performance aircraft, and of interest to the medical community, exploring the impact of a host of brain pathologies. Users of the technology now number in the thousands and span more than 60 countries, and it includes investigators at academic medical centers, much like Downstate, those in the humanities that engage in the study of language, art, and music, and it has become a tool of choice for understanding brain function in young children. It also has uses outside of the traditional academia. This includes the civilian and military aerospace companies, automotive industry, most of your high-tech companies, cosmetic and food industries, and many others, including nearly 24 research teams who are also members of our armed forces. It has also been featured in a Hollywood film with Tom Cruise. Interestingly, while most of its users have focused on understanding brain function, my focus at Downstate has been to apply this technology to study breast cancer. That's it.
Great, thank you very much. So to all who have joined us, as you can see, we've put together an incredible panel. And I'm going to start with a question that it's really a two-part question, but the first question I want to begin with, and it's a very basic one. You are all experts in a variety of different areas of medicine. I want to begin with the general question of what the closure of Downstate what would the impact be? I would say you can be as general as you wish, or if you want to specify most directly on your own areas of expertise in patient care. I'll hold off on the educational aspects. That'll be a follow-up question. Let's start with patient care and healthcare services in Central Brooklyn. And we'll start with you, Dr. Clare.
Thank you so much, Fred. The impact of closure of Downstate, it would be extremely devastating to my patients who are getting obstetrical care, maternity services. We have a labor and delivery unit, and that would be extremely devastating. The one thing that I didn't mention is that Downstate is one of 2 regional perinatal centers in the borough. What that means is that we're responsible for taking care of patients with high-risk, complex medical conditions. All of our expertise, our quality improvement efforts are geared to improvement in obstetrical care and maternity care for our patients. Childbirth process is not only inpatient, but primarily most of the births throughout the country are in hospital settings. And so this would mean a maternity desert in an urban environment for the loss of our facility. There is not enough places for patients to give birth in other facilities throughout the borough. This is an extremely impactful thing that will continue to worsen the maternal mortality crisis in the United States, specifically the Black and white disparities, which is in the borough about 9 times the mortality for Black individuals compared to that of white birthing individuals in the borough, which is worse than the rest of New York City. So this is extremely impactful. I cannot emphasize it enough for any of you who have given birth, who have a family member who've given birth, who know someone who's given birth. This would be devastating for the patients that I take care of. We'll talk about education later, but it's extremely, extremely not beneficial for the whole community to lose. Mothers, birthing people are the center of the family. So I cannot emphasize it. Oh, all the other tentacles, birthing individuals reflect the medical care for their whole families in these settings. So I'll end there, but happy to chime in again as our colleagues provide input. And we also, again, work with all of our members of our team, anesthesiologists, surgeons, medical specialists, intensive care unit specialists, etc., to take care of the high-risk complex issues for our patients medically and socially, as you already referred to, social determinants of health that our patients of care that our patients are impacted by.
Thanks very much, Dr. Clare. Now let's go to Dr. Augenbraun.
Geez, where to start with a question like this? As I mentioned, I've been here for 36 years and my work is primarily in infectious diseases. So it's not too surprising to tell you that I started my career here during the AIDS epidemic. And I'm almost finishing my career, I guess, more gray hairs on my head with the COVID pandemic. And I cannot imagine what the impact of either of these devastating infectious disease plagues would have been if Downstate had not been here to serve the community. We currently have a 1,200 census HIV clinic. We provide inpatient care, full service care to people living with HIV. And as was mentioned before, when COVID struck, we were overwhelmed doing everything we could to support the community. And I can't wrap my head around what it would be like if we didn't have this facility to provide guidance, leadership, and clinical care during those very dark periods. The inequity of healthcare, the sheer humanity of it is really sort of unimaginable. So strictly speaking, from an infectious disease standpoint, and those are epidemic issues that come on as crises. We're dealing with things on a regular basis in this community where people do not have regular access to care in the community and depend on the hospitals to provide everything, soup to nuts, for their medical care. And nobody should be surprised that we don't have the big purveyors of medical care in the state, like the Columbias, the Northwell, so on and so forth, coming into this neighborhood, because it's unfortunately the system that we've built around healthcare is not profit driven for communities that are poor and impoverished. And we really need to support these communities. I think that seems self-evident. I'll stop there.
Thank you, Michael. I see your hand, Assemblymember Williams. We'll go to you for just a couple of minutes once I get through the panel on this first question. Okay. Thanks very much. Let's go to Dr. Dresner.
So the impact of closure of University Hospital Downstate would have devastating impact on the graduate medical education at Downstate. So let me give you a little bit of understanding. So there are about 1,000 residents, between 900 to 1,000 residents and fellows that are part of our graduate medical education system. They are funded in part, at least 400 are funded through monies through Downstate. But all residents are funded through their labor at our safety net hospitals are funded from CMS. And Downstate's component of the funding for our graduate medical education is somewhere between $40 and $60 million dollars. So it would have a devastating impact. That's subsidized labor. So hospitals get paid that money to pay for the residents' work and the additional cost of the residents, over and above the fact that they do labor at the hospitals that are difficult and highly expensive to replace. A physician assistant gets paid more than what a resident works and only works 40 hours a week. So they get paid 50 to 60% more, plus work fewer hours. So that alone, the impact on education would also be dramatic. Not only does Downstate provide unique clinical experiences and volume of clinical experiences, but it provides the faculty on the as we provide care at Downstate, we provide the academics and the education for the residents, even when they're working at Kings County. So we're the academic core for clinical programs across the VA and Kings County and Downstate. Furthermore, the third aspect is to remember that accreditation, as residency programs are unstable or programs do not meet their clinical requirements, that would risk the accreditation for each of the programs. And these programs, should they be closed, could not be reconstituted in a split second. A typical residency program takes 2 years in order to be accredited to start training people. You cannot get CMS funding if the person's not in an accredited program. So these things are linked. So I think that dismantling University Hospital and the GME apparatus would be devastating.
Yeah, I was wondering, thank you, Lisa. I was wondering if you're going to mention GME, which is funding that's vital, that comes from the federal government. But again, it comes through it goes to where the residents are located and helps that cost. And without the hospital, the GME funding would not be there, which would bring great harm. Thank you for that. We'll go to Dr. Barbour.
Yes. Okay. So I'm not a clinician by training, and so my role in the hospital would be actually quite limited. So rather than echoing what has already been mentioned, I thought I would consider a broader picture. And if you will, just the most obvious question here is, given that they're looking to close University Hospital, the question is, has this ever happened before? So I actually posed this question to Chat GPT. And precisely the question was, are there any examples of the permanent closure of the primary teaching hospital for a publicly funded academic medical center worldwide? And this was its answer. There are no widely known examples of the permanent closure of a primary teaching hospital for a publicly funded academic center worldwide. The closure of a primary teaching hospital associated with an academic medical center would be a significant and rare event due to the critical role these institutions play in medical education, research, and patient care. Teaching hospitals are essential components of academic medical centers, providing hands-on training for medical students, residents, and fellows, as well as serving as centers for clinical research and innovation. The closure of a teaching hospital would have profound implications for medical education, healthcare delivery, and community health. And so I think this has utility because in this sense, it's a broad question, and we're really gaining access to the AI resource, which can recognize an unbiased and informed view on this subject matter.